Darshil Shah, one of the medical oncologists at Ironwood Cancer and Research Center. I work in Avondale and Glen locations. I will discuss, as this is a prostate awareness month, my goal is to provide you with some basic information regarding what prostate cancer is, how we approach it, what are the treatment options available. So prostate is a walnut-shaped gland which sits right below the bladder, and it's a reproductive organ, and all men have it, and only men have prostate, and it secretes substance which makes a bulk of semen and nourishes sperm. So it is a vital component in the reproductive system, but you can live without prostate. The surgery to removing prostate or radical prostatectomy does carry a risk that you may have urinary incontinence or erectile dysfunction after the surgery. So yeah, you can certainly live without prostate, but removing prostate has some consequences. Some of the consequences of having the prostate removed is because as it sits right below the bladder neck, it does control the urination very effectively. And if you remove prostate, then there's a risk that you may get urinary incontinence and you may have trouble urinating, like frequency, urgency, hesitancy, some of the symptoms that you may get by removing prostate. It's difficult to get kids if you have prostate removed because then the sperm, even though the sperm may get produced, but the viability goes down significantly. And if you have prostate cancer, some of the treatment that you get, like hormonal treatment, does affect reproductive function. So we do recommend sperm banking before we discuss about removing a prostate or start treatment for prostate cancer. That's right. The prostate cancer is increasing. There are 2.8 million men in the United States who live with prostate cancer, and there will be 161,000 new cases in 2017 with prostate cancer, and there are about 26,000 men will die due to prostate cancer. So it is prevalent, and the incidence is high. And one of the reasons is people are living longer and longer, and prostate cancer is kind of disease of old age, and as you age, the chances of getting prostate cancer goes up, and we are getting better detection. Awareness is rising, so that's rising the incidence as well of prostate cancer. The prostate cancer is also more common in certain race. For example, African Americans have double the risk of getting prostate cancer compared to Caucasians. And if you have certain genetic predisposition, like if you have a strong family history of prostate cancer, or if you have family with BRCA1 or BRCA2 type of mutation with a lot of breast cancer in the family, your likelihood to get prostate cancer also goes up.